Hello again, it's me, and it's been a little while since I've done a video. I just needed to take a break from it all, to be honest. It's been really good and it's been an adventure to kind of do all this and raise awareness, but last week in particular I needed a break from it all. So that's been helpful to me to have that break. So we're about 6 weeks nearly since my arachnoiditis flare really kicked in, and about 4 weeks since I finished the IV steroid treatment at my local hospital. I continue with my alternate day steroid, diclofenac, anti-inflammatory and LDM protocol, and things the last few days have been really good. I'm able to be upright for between 8 and even 12 hours in one stretch before needing a lie down. And then if I lie down for an hour and a half, 2 hours, I can normally be up again in the evening for a bit, doing lots of walking, doing lots of stuff at home. It's all about managing ongoing symptoms in my head and my back. Everything's still there and it does build up, but I'm doing well. Now, saying that, I did have a patch last week of a few days where things were markedly worse. I sometimes wonder if there might be something migrainous that sometimes hits me. The weather certainly affected me, and other CSF and arachnoiditis sufferers also reported that the weather last week, it changed quite quickly, and a sudden drop to lower pressure can really affect us. I woke up on Tuesday morning, even though I'd slept really well, just with this awful headache and feeling sick, and that kind of lingered in the background for a good 3 days that were markedly harder. And everything was quite overwhelming, and I had to lie down earlier in the day, about 2 or 3 o'clock, and then most of the evening, and I just had more pain and more problems. And during those times, my husband always tells me, Becky, you get these times, it will get better again. Don't let it worry you. But it does often worry us when we have harder times. I was scared, what if I'm re-flaring again and I can't go back to any more IV? What's going to happen then? But it did improve again. And the really other good news is that my sleep is now pretty much back to normal. I still do wake a few times in the night, and I need the loo often a couple of times in the night, but I'm getting back to sleep well and getting good sleep. So that's really good. So on that level, it feels like this week, since about Friday, things have very much been more restored, and I'm doing much better again and back to more managing my baseline symptoms still. I just want to add here that last week I also had a letter from my last appointment with my CSF leak neurologist, who's at a different hospital to where I was treated for the arachnoiditis, a different NHS hospital, and he has also confirmed the arachnoiditis diagnosis. So I have a written arachnoiditis radiologically confirmed diagnosis from 2 NHS hospitals in the Midlands in the UK at the moment. So that's a good thing. You always know you're put in a stronger position the more doctors and different opinions when they come up with the same conclusion. So that's good. So that was following a face-to-face appointment with him about 3 weeks ago now. As I've said recently to my husband and other people I've seen and talked to, it's actually a really helpful and liberating thing when you finally get a diagnosis and get answers to your many questions. Now, I've been diagnosed with a spinal CSF leak from about 2-3 months after my original injury, but of course that wasn't confirmed radiologically until about 5 years after that happened. And whilst you don't have a confirmation radiologically, there's always questions about your case from doctors, from other people. And that can really impact your mental health. You can doubt yourself, you can feel a lot of shame, you feel like you have a diagnosis and you can talk about it, but you're not taken as seriously if you don't have it radiologically confirmed. But ironically, I didn't actually find out it had definitely been radiologically confirmed, the leak, until after I found out about the potential arachnoiditis. So the two kind of came hand in hand, but they certainly brought me to a better place of my self-awareness and liberation when that was so. So it's amazing, really, after a 5 to 6 year search for answers, a lot of the radiologically evidenced and confirmed answers came together in the spinal CSF leak being confirmed by my NHS hospital specialist team, MDT, and the arachnoiditis being confirmed by my other hospital that I went to first about the CSF leak, my more local hospital, and their team, and the corroboration and cooperation between the two hospitals that will hopefully help them learn together, because one hospital has evidenced the CSF leak and the other hospital has evidenced the arachnoiditis, and they're able to share that information. And as I say, that really does help me mentally. I was saying to my husband even just yesterday that awareness helps me to plan better for the future, knowing that the arachnoiditis at least is not something that's going to go away. Really, our best option is stopping progression at the moment through the steroids and the anti-inflammatories and the medication. There are so many unknowns about the future. We don't even know for sure, does my spinal CSF leak, is it permanent? Does it come? Does it go? Is it kind of partially? Sometimes people in surgery, the surgeons can often find in neurosurgery that their leaks have membranes over them which stop them fully leaking, but they're still seeping. If it is and was caused by a bone spur, that bone spur could still be in to the dura, or could intermittently kind of break in and cause a leak, which then heals. There's so many things we don't know about that. But regarding the arachnoiditis, we know that it's there and it's trying to progress, and we're trying to stop that. And that just gives me more awareness and more ability to plan and be aware that I have a condition that probably will keep flaring. I will keep relapsing at times. But my spinal CSF neurologist and myself have decided that we're not able to pursue any further diagnostic scans, invasive scans such as CT myelograms or digital subtraction myelograms or blood patches now because of the arachnoiditis. It's too much risk for me. And actually we can't even be sure how much of an impact it's having. As I said before, if it is there, it could be helping me if it sometimes acts as a natural shunt to the higher pressure that can come from the arachnoiditis. So for now, definitely we're kind of holding on any further treatment or diagnostics on that level to focus on the arachnoiditis. But thankfully I stay under 2 hospital care moving forward, and hopefully we can all learn together through that. But I want to add that apart from that little blip last week, which may well have been the weather, may well have been migrainous, may well have been just the past few weeks before that kind of getting to me and the lack of sleep and everything. Last week I had a few days that was harder, but as I say, from Friday things are much better restored, and I'm doing comparatively well again. It's there. I have to deal with horrific levels of pain every day. It just gets worse as the day goes on, and it needs managing. And it's so complicated. There's so many complexities. I wake up, my head can be funny. If I get up in the night, my head's funny. Going to the toilet, my head's funny. My back is often in pain, and that builds up as the day goes on. I hardly sit. I stand a lot. I walk. but it's more manageable and it's more under control, and that has been revolutionary on my mental health and ability to cope with the illness in general. Although I have to say, when I do have harder days, that becomes harder and more overwhelming and the fears come back. But when things do improve again, then it encourages me that we are more in control, and I have good support team at 2 hospitals, neurology departments and other doctors, and a good GP team locally, and that gives a patient a lot of confidence that there are people that know how to care for them, and that helps their mental health a lot.